Hey everyone. Recently I had a really interesting case, and it really stuck with me because it was not only interesting from a medical point of view, but also interesting in terms of, supporting the patient and their family in getting through what was the beginning of a really tough time. And it made me kind of remember, because sometimes we forget just how nice it is being a GP and how lucky we are as doctors, you know, to be helping people through those really difficult times. Made me think of, all that hard work in becoming a GP. These were one of the moments that I really enjoyed and gave me that satisfaction. So it was a patient who came in with their family, and they had bilateral PEs, pulmonary emboli, blood clots in both sides of the lungs. The reason why they had so many blood clots is because of the underlying condition being cancer, and this was cancer that had kind of just spread all over the body, from the lungs to the organs in the middle of the chest, liver, pancreas, back, all over, and potentially there may have been other areas affected. Um, and that patient came in. They were, generally speaking, stable in terms of blood pressure and temperature and things, but needed some painkillers um, for the area of pain in the back that was principally brought them in, for which I was happy to kind of oblige. So gave them some painkillers. It was um, it was clear that the family and the patient knew what was going on, but they hadn't really had time to sit down with any of the doctors and digest what had happened over the last week or so. No one had really gone into the specifics of what was on the scan, and no one really kind of gone into detail over the parts of the body where all of these suspicious cancerous, probably cancerous lesions were. Um, and I think they were happy to sit and go through and actually have that explanation, because otherwise they were kind of in the dark. And that was for them much more, that was worse rather than actually knowing what was going on. Um, so yeah, it wasn't really anything medical. I didn't, I gave some painkillers, but didn't really change the medical management. The cancer specialist oncology referral was going to be later on that week, and so it was just a case of biding time and stabilizing what we can until we see the cancer specialist and see, well, what treatments are available. Do we need to do things like biopsies, or can we just treat based upon what we see on the scan? It was all up in the air, really, and even those advanced decision making, like, do not resuscitate orders, so don't start CPR, chest compressions, ceilings of care. People talk about intubation or ventilation on ventilators and ITU, whether that's the sort of thing that was required. None of those questions had been approached, and in fact, it wasn't the right time to approach those questions, but it probably was the right time to say these questions are going to come up at some point, and so to try and be aware that that's coming and be more mentally prepared. Um, if anything, it was more of a case of getting one's affairs in order was one of the phrases used. That people needed that understanding of, okay, this is the beginning of the end now, potentially or likely, and so we really need to get things in order from a personal point of view, because who knows how much time is left. Um, so it was really satisfying helping them. It's not the sort of case we see all the time, but most GPs would see them, would have some or uh, regular palliative patients once in a blue moon. Um, it also made me think about what it's like if I'm ill or my loved ones are ill, and how important it is to have healthcare professionals who are not burnt out, who are not just ticking a box and getting you out the room and seeing the next patient, because we all have quotas to hit, and we all have long lists of patients, no matter what specialty you're in. But that being able to value people's time and being able to explain what's going on, to bring them up to speed. It really felt satisfying that I'd done some good. Um, the rest of the shift was normal. It was antibiotics and it was painkillers and it was medication reviews or mental health reviews or chronic disease reviews or acute emergencies. Um, but that sort of case doesn't come up all the time. Um, and it really reminded me of why I got into this job. And it's something that whenever I see junior doctors or GPs or hospital colleagues complain about the state of healthcare, um, it is something that we really need to address and change because, um, well, if the doctors don't fix it, then we're going to be waiting for others to fix things, and I'm not sure that the people not giving the care are going to be able to do that. As well as, and this equally affects all clinical colleagues, no matter if you're a midwife or a nurse or a paramedic or a pharmacist, it's going to affect everyone. But um, yeah, it's important, and I think that's one thing at Cornerstone. When I set this up, it was to try and enable people to be able to get access to good quality care from a local GP, at least in my local area, but hopefully other GPs in the future, if and when they join, in order to be able to get that access and that care and that high quality, because people value it, and I value giving it. All right, thanks for watching, and any comments, feel free to comment below.